This is an Airbnb that my daughter and I are staying in. So I also have to go in and see the surgeon after 10 weeks to make sure that the incision inside my vagina has been healed. So it takes about 10 weeks to have everything be healed from the surgery, apparently. Another thing is too, like, you cannot roll over on your side or sleep on your side for 4 to 5 weeks, like, at all. And I have to sleep on your back very carefully the whole time. I'll say that I haven't had to have many painkillers. I haven't needed painkillers after day 4. I just feel some discomfort and pulling kind of feeling and tenderness, but no severe pain. Like, you literally don't need to take oxycodone and all of those after day 4. At least for me, I stopped taking them. So a lot of people will tell you that, oh, this surgery gets done all the time, it's not a big deal. I know someone who was back to work in a few days or a couple of weeks. Don't believe them. It's not true. This is major surgery. You have to be very careful. It takes a whole 2 weeks to even not have your shots every day and to be able to walk around carefully, for more than a few minutes at a time during the day. It takes 10 weeks for your body to totally recover, and it takes 5 to 6 weeks before you can even lift anything that's 10 pounds or travel. So it's a big ordeal, and it's not easy. I've had really major muscle spasms in my stomach which wake me up in the middle of the night. Really violent muscle spasms right in my surgery area. And, that's scary because you're trying to do everything you can to not cause a problem during healing too. So, yeah, this is a big surgery. It's not a little bitty little non-ordeal. It's huge. And this is the extent of my life over the last 5 days. I have to give myself injections in my stomach once a day for 2 weeks to keep from having any blood clots. And I can't lay on my side or do anything for 2 weeks. And then after that, I just have to be super careful and not pick up anything over 10 pounds for 6 weeks. So I've been pretty much laying in this bed for 5 days trying to mend my wounds. This is my uterus on the upper left-hand side. The green ones are my lymph nodes, and that's the tumor at the bottom. I think one of the hardest things is to give myself these shots every day. I'm just counting down the shots and the days until I don't have to do this anymore. So at this point, I have 5 shots left. And this is to reduce the chances of getting blood clots after surgery. So I have to give this shot to myself in the stomach every morning at 11 o'clock. It was a really big surgery. And it's kind of surprising how many people downplay this surgery. Like, they'll tell you that they heard from a friend, or, some relative was back at work the next week or something like that. And first of all, the type of surgery that I had varies from person to person. And the way that they do the surgical procedure varies from person to person. Some people just have one organ removed and that's it. Some people just have their uterus removed. Some people have their uterus and 2 fallopian tubes. Some people have the uterus, 2 fallopian tubes, and 2 ovaries removed. Some people have the cervix removed on top of that, and others will have lymph nodes removed, different amounts of lymph nodes. They either have to go in with a traditional surgical method, which takes a lot longer to heal, I can't imagine, because I had the laparoscopic robot surgery, and that's the less invasive one that takes less time to heal. But I gotta tell you, it's a huge surgery. Like, they have to put an incision inside of you through your vaginal area, and then they do an incision near your belly button, and they do 2 more incisions on each side of your belly button, and 2 more incisions beside that. And they go in from all angles, and then they have to cut all of those organs out and remove them, and then, suture things back together so that you don't bleed and you can heal up inside. It's a huge surgery. It takes a lot of time to heal. And right now I'm on my 2nd week, day 10, and I'm just now getting to a point where I can walk around slowly but fairly normally. I cannot lay on either one of my sides until the 4-week period. Day 10, I'm still taking shots daily in the stomach, which is not fun, you guys. It's scary, it's uncomfortable, it causes bleeding and bruising. You have to do it just the right way. Even after 6 weeks, the inside of my vaginal area and cervix is not going to be healed for 10 weeks. Okay, 10 weeks. Then they have to check me at 10 weeks to make sure I am healing in that area. So this is not a minor surgery, you guys. Some people make light of it, and they shouldn't. It's big, and it's, I think one of the worst parts is, you have to be so careful. You can't move around normally, can't live a normal life for quite a while. It's kind of like you count down the days, right? But I did get through the surgery okay. I did not need a blood transfusion or anything like that. And, everything worked out. I got a call from the nurse day before yesterday telling me that they got all the cancer. They did the blood or the tissue testing afterwards, and so they got it all. So I don't need any additional types of treatment in that area. But I'm very grateful that everything turned out okay, and I'm here. I'm not done with my cancer story yet because, unfortunately, I have another part of my body that needs to be biopsied, and that would be right here. You can see how big this tumor is. And my endocrinologist and my surgeon both are worried about it, and have been kind of pushing to get it biopsied soon. But there's really nothing I can do about it to get it biopsied sooner because I can't move around and I can't travel. And when I originally was scheduled to do the biopsy, I started bleeding a lot and possibly could have been hemorrhaging and couldn't travel out of the city to go get a biopsy. And it actually ended up in the emergency room the day before the scheduled biopsy from all the bleeding. And that's why my cancer surgery got moved up. I'm not willing to travel on the freeways for 40, 45 minutes one way, and then worry about getting up on a high table and then being stressed out while they put needles in my throat while I'm still recovering. Especially not 2 or 3 weeks into my recovery. So I have to wait. I don't have a choice. So hopefully everything will turn out with my biopsy. Right now it's scheduled for the 26th, which is at my 3-week mark. But I think I'm going to push it out to week 5 or week 6 because I don't feel comfortable
traveling and putting myself through that, because one little wrong jolt, one little fender bender, and I will have internal bleeding and all kinds of emergency situations. So it doesn't seem, safe to me to go do that until I'm healed. So that's where we stand right now. Once I get this checked, hopefully it's still benign. If it's not benign, then I have to go through another cancer surgery. So keep praying, you guys. I appreciate it. I'm starting to go back to work. I did 2 phone calls today. I've got 1 more phone call. So I've been doing crisis counseling by phone. And I had 1 phone call yesterday and 2 phone calls 2 days before that. But it was exhausting. And the day after tomorrow, I'm back full-time. Tuesday, Wednesday, Thursdays, really long phone shifts. So I don't know if I'm going to actually be able to make it. So we'll see. Thanks for all your prayers, you guys. And thanks for sticking around. Eventually I'll be back to my travel videos. Bye.